Welcome to Horizons of Thought. Today I'm going to talk to you about one of the most difficult public policy issues in relation to COVID-19, and that is that different people have very different experiences of what this disease is like. On one extreme end are doctors, nurses, and EMTs who work in large city centers who have had outbreaks of COVID-19. Many of them will have been working 16-hour days, 6 days a week. They will have seen so many sick people come in that they don't have enough intensive care units for them, so they have to put them in normal beds. They don't have enough ventilators for them, so they've seen people suffer and die for lack of medical technology. They've seen so many people die that they've had to rent refrigerator trucks to hold the bodies because there's no more room at the morgues for the dead. It's incredibly difficult for them. They have been exhausted, overworked, getting post-traumatic stress disorder, feeling unbelievably miserable. And for them, it's exceptionally hard when they see people who won't wear masks, when they see people who won't socially distance, when they see people who don't take this disease seriously, or even people who claim that COVID-19 is a hoax. But on the other hand, imagine you are a young, healthy, working class person who plows fields, picks weeds, harvests crops, cleans roads, does any manual labor. You may not know anybody in the healthcare industry. You may not know many old people, especially if you're a migrant worker and you've come from far away and you're not anywhere near the elderly. For you, this is a disease that, according to the data from the World Health Organization and CDC, upwards of 95% of people in this age group who get the disease have symptoms so mild they don't notice them. They may not have any symptoms that they can perceive at all. The 5% who are left, food might taste funny to them because it doesn't smell right. Their toes might swell up, might get a cough, might throw up, but it's unlikely that they're going to have to go to the hospital. It's unlikely that they know anybody who's gotten very sick or died from COVID-19. Their situation is they're finding that they've had to go into lockdown when they don't have a lot of money. Their job has been deemed non-essential and they can't work. They're having trouble feeding themselves. They're having trouble feeding their families if they have a small business that they've started. They're having trouble keeping that business afloat. In some cases, among these working class or young white-collar workers who own their own small businesses, they're finding their life stream fall apart before them because their business is gone. And in some cases, those businesses are never going to come back. They're suffering too. The destruction of everything that they've worked on is before them. And they're being asked to care about a disease that doesn't affect them and doesn't affect the people around them and doesn't seem particularly real. They don't understand why they're asked to wear masks and socially distance after having seen only a few people get sick and not very bad. And they especially don't understand why they have to go into lockdowns and why they have to give up working on their businesses and why they have to go bankrupt. For them, their problems may not be as existential as watching people die, but they have to live with the devastation that's happened with their lives nonetheless. If you're a public policy person and you're facing a disease like this that has such very different outcomes for very different groups of people, you have your work cut out for you. You have to find a way to teach empathy to people who are going through their own grief and sometimes very badly going through their own grief, to teach them to have empathy for people that they do not see and they do not understand. And this is just as true for the healthcare workers as it is for the blue-collar workers that I'm talking about. It can be incredibly difficult to make that happen. Humans are very bad at having empathy for anybody else when they themselves are suffering badly. After all, they need help themselves. They can't then expend what's left of their energy to concern themselves with things that they can't see very well. The second thing I would say in the face of this is you may not win in any real sense of the word. It's going to be very difficult to actually get outcomes that are what you necessarily wanted. You might be able to get those poor people to wear masks most of the time, but some won't. You might be able to get people to socially distance most of the time, but some won't. You probably can't actually keep them away from their businesses and lock them down for too much longer in many cases, because you might find yourself with riots and rebellions and people just saying, no, I'm not going to do it. Send the cops after me. I've got 100 other buddies. They're going to open up their businesses again too, what's left of them. You can send the cops after them. You can play whack-a-mole with us. There are other kinds of solutions to be done when you're facing this as public policy, that you lock people down and you do social distancing and you get people to wear masks as tools to address the problems in other ways as well, like increasing the amount of beds in hospitals and in particular intensive care units, increasing the amount of ventilators, which is something that's been done quite well in many places in the world, increasing medical training slowly and changing the way hospitals work. So maybe you go back to what we used to do back when consumption or TB was a bigger deal, where you would have hospitals that had special isolation rooms to deal with people who were very ill for some time, or have community care that deals with this kind of thing. Use solutions that are hard to enforce because they conflict with people's empathy and with their needs as temporary measures to enact solutions that are going to work better long term and realign all the various peoples in your society under the same kinds of goals. Even if you do all of that, it still won't necessarily be as easy as you hope. We do live in a world with limited resources, and I don't just mean limited money. You can borrow money or print money for a while. I mean limited human capital. It can be very hard to train new people in technical skills that take many years. And by the time that's done, this particular pandemic is going to have a vaccine. People are going to be taking that vaccine, and it's going to be going away. And my advice would be is you want to actually think about this more long term, to have policies in place, because while this pandemic is going to go away, pandemics aren't going anywhere. We've had them actually quite a few times in the last 100 years, and we've had worse ones, many, many worse ones, and we're likely to have worse ones again. So it's worth paying attention to the underlying issues that can then strengthen a society. More medical beds, more ventilators, better education of people when it comes to numeracy and math so they can understand real risks better. Better understanding of how to present the point of view of other people instead of siloing people into their own groups. You name it. These are good things to do. The last thing I'm going to say is, if you're in public policy or you're a politician, and I really have to say that I'm grateful for all of you who are doing this, even if you're doing it relatively badly, I am grateful. And I would hope that my viewers would learn to be grateful in the face of the public policy that they get, even if it's only halfway okay. That's a bit of a miracle, because this is a real tough one. And with that, that has been Horizons of Thought. I hope that you enjoyed this episode. If you did, please click like. If you didn't like it, click dislike. And in any case, please comment below. If you want to support the channel, you can subscribe, or you can go down to the donor box link, click on that, and make a contribution to this channel, a subscription contribution to this channel. I provide rewards based on the amount of that contribution. And with that, I hope you have a great day.